Today our topic is capillary blood sampling. A capillary sample is a blood sample collected by pricking the skin. Capillaries are the tiny blood vessels which are near the skin surface. In the neonate, it is generally performed by the heel puncture or stick. This is the minimally invasive and easily accessible method of obtaining the capillary blood sample for the variety of tests. Heel puncture, stick sampling can also preserve the venous access for the future intravenous lines. Capillary sampling can be used to take the small volume specimens for monitoring. They are blood glucose level, blood gases, full blood counts, serum bilirubin, urea and electrolytes, drug level, and the newborn blood spot screening test. Good technique is important to avoid the following problems. For sample problem, we can use the inadequate sample volume. This requires the repeat specimen. Clotted sample, giving the false positive for the thrombocytopenia or requiring the repeat specimen. Sample from poorly refused HeLa. Overestimation of the degree of acidosis and the hypercarbia. Hemolyzed specimen giving the abnormal parameters such as high potassium or no result. NB. Consideration should be given to repeating the specimen, possibly using the venous sample if the result is out of keeping with the baby's condition or the previous results. Morbidity for the baby. Increased pain, local trauma, infection, damage to nerves, blood vessel and bone, and excessive blood loss can also cause the morbidity to the baby. Depression, cluster care. Prior to carrying out any procedure on the baby, the practitioner must be familiar with the infant's plan of care. In order to provide the developmentally supportive care, an effort should be made to cluster any blood sample required as well as trying to time the sampling with the baby's care as far as possible. Check patient ID. Ensure the positive identification of a baby and that name brands, blood forms and bottle all correlate. Double check the number in case of twins to ensure the right test for right baby and labeled appropriately. Consent. If required, consent should be sought from parents prior to the procedure being carried out. Example, newborn blood spot screening. Ensure a safe environment. Ensure the baby is appropriately positioned, contained, swaddled. Analgesia. Whenever possible, involve the mother in the procedure using skin-to-skin contact, breastfeeding or non-nutritive setting. For some procedure, oral sucrose may be used. The shaded area on the lateral aspect of the heel or performed sites axis avoids the main nerves. The area should be examined for the previous recent punctured sites and the chosen site rotated if frequent sampling is required. Requirements: non-sterile gloves, cotton wool or gauze, capillary tube and the blood bottles, lead lancet for puncturing the skin. An automated incision device should be used. Clean disposable tray to hold the equipment. Sharp disposable box, alcohol wipes, soft paraffin. This may not be required for the small specimens such as the simple blood gas analysis. It may prove useful for the larger specimen. For NICU, SCBU babies, each baby to have an individual tube. For OPD or the PNW settings, a small quantity may be squeezed into the edge of the procedure tray before the procedure commences. Procedure for obtaining the sample. This is not the sterile procedure, however, a clinical hand wash should be performed or the alcohol gel applied. To obtain the blood sample, give appropriate analgesia. Consider the parental involvement as a rule. Ensure the baby is lying in a safe and secure position. Hold the baby's heel with the non-dominant hand. Hold the ankle with index and middle finger. Use other finger to steady the baby's leg. Partially encircle the baby's heel with the thumb. Clean the proposed puncture site with the alcohol wipe and allow to dry for 30 seconds. Gently compress the heel and hold the skin under the tension. Puncture the skin in a steady and intentional manner. Relax the tension and wipe away the initial blood flow with a cotton wool or gauze. Whilst maintaining the grip, hold the heel so that the blood is allowed to hang. Gently but firmly compress the baby's heel to form the large droplet of blood. Do not squeeze the heel. Allow the heel to hang below down to assist the blood flow. Hold the capillary tube or the blood bottle to the blood droplet and touch. Momentarily release the pressure to collect the subsequent blood, then apply the pressure, allowing the blood to flow. Continue until the sufficient blood has been obtained. If the blood flow stops, clean the site of old blood. Allow time for capillary refill. Reposition the hand and reapply the pressure. If the blood does not flow, Choose another site and repeat the procedure. While completing the procedure, once the sample has been obtained, apply pressure to the site with the gauze. Maintain the pressure until bleeding is stopped. It is not essential to apply the plaster and is the best avoided in the hospital setting. If there is a minor oozing, then a spot plaster or the gauze ball and the hypoallergenic tape may be applied for the few minutes. They should be removed when oozing has ceased. The baby should be left comfortable. Equipment should be disposed of according to the hospital waste policy. The person performing the skin picture should wash their hands. The sample should be sent for analysis as soon as possible. Thank you.